good afternoon. I'm Elizabeth Boynton. I'll be doing your assessment today. How are you doing?
I'm doing good, thank you.
And can you tell me your name?
My name is Mary Smith.
Hi, Mary Smith. So what brings you here today?
I'm just here for my annual physical.
Okay. Can you tell me when your last physical was?
It's probably been about 2 years.
2 years? Okay. Are you taking any current medication or any medication changes since the last time you saw me?
No medication, just vitamins.
Just vitamins? Okay, just like a women's one a day?
Yeah, I take a multivitamin, a B12,
Okay, B12.
and some calcium, vitamin D.
Awesome. Okay. Calcium. Do you have any allergies?
No medication allergies. Environmental maybe, seasonal.
I think everyone in Florida has some type of
I know,
seasonal
I
allergy. Do you take anything for your seasonal allergies, or do you just take something over the
Just
counter?
over the counter.
Okay. All right. Any medical history, like surgical procedures, anything like
I
that?
had a C-section years ago.
Okay. Any complications with that?
No.
Okay.
But no other surgeries.
No other surgeries. Okay. Are you up to date on your current vaccinations, like flu shot, pneumonia?
I probably need a flu shot. I have not had one this year.
Okay.
And a tetanus has been longer than 10 years.
Oh, yeah.
So I probably need to get that too.
Okay, so we'll do that. Tetanus. What about your screenings? Have you been screened for colorectal cancer? Your mammograms?
No, I'm overdue for the colonoscopy.
Okay.
Mammogram I am up to date with that. PAP, no, I'm due for that.
Okay, so pap smear. All right, we'll take care of you today. Any family history?
Let's see. My dad has some cardiac issues.
Okay.
He had some stents in several years ago.
Okay, is he still alive?
Yes.
Okay.
Yeah, he's 81.
Wow, okay.
And my mom has MS,
Okay.
and she's 81 also.
Okay. She's 81. Any brothers, sisters?
No.
Okay. And you said that you had one C-section. Going back to that, how many children do you have?
4.
4. So 1 C-section and 3.
3 natural deliveries, and the last one was a C-section.
Okay. C-section. Okay. Anything like your social history? Do you use drugs? Are you a smoker?
I've never smoked.
Okay.
I use alcohol occasionally,
Okay.
maybe a couple of times a month.
All right.
But that's it.
Have you noticed any change in your vision? Do you wear glasses or
I
contacts?
wear glasses for driving and distance.
Okay.
Yeah.
Any change in your hearing? Do you have any like tinnitus, anything like that?
No.
Okay. Any change in your eating habits? Any weight loss or gain?
No, it stays stable.
Okay.
Between probably about a 5-pound range.
Okay.
Up and down.
Any change in your bowel habits?
No.
Frequency?
Mm-mm.
Okay.
No changes.
Any change in your thought processes?
Sometimes I think my memory is gone.
Oh, do you want to elaborate on that? Okay.
I think it's just busyness and
Yeah,
up and
holiday
down to that.
season. Okay.
Yeah, it's a lot of
All right. Do you exercise regularly?
I try to. I try to get to the gym about 3 times a week.
Oh wow. Whew.
Yeah.
Okay. Any range of motion issues? Any aches and pains?
No.
No. Okay. I'm just asking about that with your mom's history, making sure of that. How tall are you?
I'm about 5'1".
5'1". And about how much do you weigh?
About 106.
106. Okay. Great. Well, thank you for giving me that history. I'm going to take your vitals right now, okay? So you ready for holidays?
Yes, well, I will be on the day.
There we go.
I still have some shopping to do, so.
There we go. 112 over 77 with a pulse of 76, respirations of 15. All right. Thank you. Now, is that normally like a baseline for you? That's normal?
Yeah, it's pretty close, yeah.
Okay.
Yeah.
That's normal. So no white coat syndrome there.
Not today,
Yeah.
sometimes.
That's good.
Yeah.
How you doing?
Good.
So I'll have you up here.
Okay.
I'm going to look over your skin just to make sure there's no like any lesions, scrapes, any inflammation, that type of thing. So can I see your hands and
absolutely.
nails? Okay. All right, I'm testing for the moisture.
Okay.
If this were my actual patient, she would be gowned and I would be looking at other parts of her body and skin. I would be assessing her ankles and her feet, looking at the face. I know that she's, talking to me and there's no sense of paralysis in her face. And she's making good eye contact with me. I'm gonna feel along your face and
Okay.
also your head just to make sure that there's no lesions or
Okay.
bumps or anything like that, okay?
Okay.
Do you use sunscreen?
Yes, I try to.
Okay. And what SPF?
For the most part.
Okay. What SPF do you use?
Usually a 15-ish.
Okay. So I would probably bump that up a little bit. Okay.
Yeah.
And how old did you say you were?
I'm 58.
Okay. So let's bump that up a little bit and make
Okay.
sure that you apply it right to your nose and your cheeks and along your ears and even along this area right here because
Okay.
that's really exposed to the sun.
Yeah.
Okay. I'm going to feel along your artery right
Okay.
here and also your joint where your jaw is, okay?
Okay.
Okay, can you open? Open again. Okay, again. Okay. Any pain with that?
No.
Okay. Now I'm going to test to see if there's any pain in your sinuses, your frontal sinus, maxillary, any pain?
No.
Do you have any discharge coming out? Any seasonal allergies right
Oh,
now?
I got some seasonal allergies going on.
All
Yes. My nose is running.
Oh no. Okay. So there's no lesions. The temperature's good. There's no roughness. I'm not concerned about anything like that. Okay.
Okay.
Right. So now I'm going to assess your eyes. Okay. I know that you said that you haven't had much change as far as since we've last seen you. Have you noticed any changes in like whether you need to read up close or bringing it out far?
No, I still I use the glasses for distance and for driving, watching TV.
Okay. So
but
just
for-
readers. Okay.
Mhm. No,
Alright.
I don't use readers at all.
Okay.
I don't have any problem with that. It's just the distance that I have any issues with.
Okay.
Yeah.
All right. So I am going to be assessing your eyes.
Okay.
I'm going to look at your conjunctiva
Mm-hmm.
and looking at if there's any bumps
Okay.
around your eyes and also your visual field.
Okay.
So I'm going to stand kind of right in front of you if I was right there. So can you see this? Tell me when you can see it.
I can see.
Okay. And then can you see this over here?
Yes.
Okay. And
Yes.
okay.
Yes.
So I just assessed for 2, 3, 4, and 6 cranial nerves. Her eyes are moving, steady gaze, everything like that. I'm going to look for perla, which is the accommodation of light. So I'm going to be shining a little bit of a light in between.
Okay.
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 That's good. 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 All right. Now I'm going to pull down your eyelids just a little bit just to make sure that it's just pink and not irritated. And like you said, you do have a little bit of an allergy,
Yes.
so I just want to make sure that you're not having any type of inflammation. So that looks pretty good. The sclera is white. So good. to assess your hearing, okay? I know that you said that you haven't had any auditorial changes as far as like ringing in the ears. Our conversation hasn't been like you raising your voice because you can't hear me, or are you hearing me okay right now? Okay. So I'm going to look into your ears and make sure I can see the tympanic membrane and it's clear. And then I'm going to conduct a hearing test, okay?
Okay, that's fine.
Alright, so first, is there any tenderness, any drainage? I don't see anything like that. I'm going to push to make sure there's no tenderness. Okay. Alright. Tympanic membrane visualized. No drainage. Alright, I'm gonna step on the other side. Move your lovely hair. Okay. It's cord.
I know.
Okay.
Doesn't like it so.
Alright, tympanic membrane visualized. No drainage. No pain. Okay. Appropriate size. Alright. Now this is called a tuning fork, but basically, can you hear this?
Yes.
Is one greater than the other?
No, they're about the same.
Okay. So you should actually feel the vibration and hear it. Do you hear it?
Yes.
And is it equal on both sides?
Yes.
Do you hear that?
Yes.
Do you hear that?
Yes.
Is it greater
No.
or about the same?
About the same.
Okay, good. Alright, next I'm going to look at your nose. There's no drainage and there looks to be no inflammation. Has there been any pain in there?
No.
Okay. So I'm going to take the otoscope again and look in, okay?
Okay.
So I'm looking for redness and drainage. Okay, no redness. And no redness and drainage in there too. Alright, and so this morning, did you make coffee? Did you smell it? Okay.
Yes.
Okay, so any changes in like the sense of smell? Okay.
No, none that I've noticed anyway.
Okay, sounds good. Alright, next I'm going to be looking into your mouth. I'm going to make sure that there's no lesions, no sores, appropriate moisture, looking at your tonsils, your uvula, and actually stick your tongue out at me. Alright, so that's good. So I'm going to shine a light in your throat.
Okay.
Alright, open. Alright, looking at teeth, moisture, and when was your last dental cleaning?
It's been over a year.
Okay. Alright, say ah.
Ah.
Alright, say it again.
Ah.
Okay. Looks good. So the cranial nerve 12 was assessed with the tongue. And next we're going to be going to your neck, okay? I'm going to assess your neck.
Okay.
I'm going to check for any breweries in your carotid. I'm also going to look at your thyroid, or feel your thyroid, okay?
Okay.
So I'm going to... Any pain in your neck?
No.
No? Okay. Using the bellow of the stethoscope. Alright, no bruise. No jugular vein distension. Any pain? Okay. Thyroid. No tenderness.
No.
Okay. Now I'm to assess your strength in your neck. So just resist my push, okay?
Okay.
All right. Resist. Resist. All right, forward. Resist. Resist. Any pain?
No.
Any pain in your neck? All right. I'm going to use my stethoscope and listen to your heart sounds to make
Okay.
sure that there's no murmurs, gallops, regular rate and rhythm, okay?
Okay.
Okay, I'm going to go underneath a little bit. Okay. All right, now I'm going to check your pulses, make sure that they're equal bilaterally,
Okay.
peripherally, as well as pedal pulses. If you were my patient in a gown, I would assess for the femoral pulses and also like inguinal nodes if there's any like type of inflammation or tenderness.
Okay.
So let's do that. Okay, now I'm going to move to the feet, checking for pedal pulses. While down here, I can look for hair distribution, skin, any type of tenderness, lesions, which I already looked for. So that's good. Next, I'm going to listen to your lungs.
Okay.
Have you had any shortness of breath, anything like that?
No.
Okay. First, I'm going to listen in the front, and then I'm going to listen to your fields in the back.
Okay.
Big deep breath. Again. Lung sounds are clear so far. Okay. Good breathing. Okay, in the back. Good. And the bases. So there's been no like sick contacts, no one's sick.
No.
That's good. All right. Mrs. Smith, I'm going to look at your abdomen to make sure that there's nothing funky going on down there. Okay.
Okay.
Have you been having any stomach aches? No slow digestion? Any abnormal bowel movements? Nothing like that.
No.
Okay.
Nothing.
All right, so first, if this was my patient, I would actually lift the gown and make sure that there's symmetry and no like lumps and bumps, bulges. And then first, I'm gonna listen to it, okay? So all 4 quadrants. There's lunch. going to percuss, and that's just a little bit of a tap to make
Okay.
sure that there's no pain. Any pain?
No. Okay.
Okay. Next, I'm going to palpate your liver and your spleen, okay?
Okay.
So, there should be no liver accent really, no spleen. So that's good. Any tenderness?
No.
Okay. Now, I'm going to perform some deep palpation, so if I get a little bit uncomfortable, just try to breathe natural. Breathe natural. Any pain?
No.
Okay, that's good. Next, I'm going to assess neurological. Can you put your arms out in front of you? Okay, can you close your eyes? Okay, I can also assess this when she's standing, but basically I'm looking for a drift. Is this up or down?
Up.
That up or down?
Down.
That up or down?
Down.
Okay, good. Next, I'm going to assess for sharp and dull. I'm going to use a pen, so I can see your hand. Is this sharp or dull?
Dull.
Okay. So, is that sharp or dull compared to that?
It was sharp compared to that.
Okay, so that's sharp.
Okay. Sharp.
Okay. Do the other side.
Sharp.
And then,
Dull. Sharp. Dull.
okay. And then I can assess on your legs as well, on your feet.
Sharp. Dull. Sharp. Dull.
Okay, and then on your thighs.
Sharp. Sharp.
I need to go deliver a prescription for Kevin Davis.
Okay, sir.
I'll be right back.
All right, sir.
Can I interrupt? Is the red light on?
Yeah, the red light's on.
Oh shucks. Hey, guess what? You did great. Listen, if you're gone by the time I get back.
You just wanted a cameo. It's okay.
That's true,
You
yes.
want a
it is.
cameo?
This is my voice.
All right.
Yeah, okay, yes.
All right.
We're very proud of our student. She's doing lovely. All right. Your big day.
Thank you.
See ya.
You just wanted a cameo.
Yeah, exactly.
All
I
right.
just couldn't
So,
stand it.
so I think that's neuro.
Okay.
Any sense of absent dysphoria? Like, do you know how to get home?
Mm-hmm.
You know how to get to work? You know how to do your normal active living? Okay.
Yeah, no problems with that
Okay.
yet.
Well, don't say that.
I know. No.
Alright, so we're gonna go back to the neuro.
Okay.
Since we were interrupted, it kind of threw me off a little bit.
Yes.
So what I want you to do is do what's called a heel to shin.
Okay.
And what you're gonna do is take your heel, go up your shin to your knee, and then down, and you're gonna do that to both sides.
Okay.
Okay?
So just heel to shin like
Yep, heel to shin, and down, and then the other side. Perfect. Now, I want you to touch my finger, and then touch your nose.
that. Okay.
Touch my finger, touch my nose. Your nose, my finger, your nose. There we go.
Okay.
Now you touch my nose, right? All right. Fun knee strike for reflex, okay?
Okay.
So I'm going to test your patella, okay? Okay. Then back here. It's hard to see through your shirt.
Yeah.
Okay. Go on the other side. Sorry about that.
Okay.
Alright, so now I'm going to assess your range of movement.
Okay.
I'm going to ask you to stand up. Alright, any pain?
No.
No, okay. So I want you to bend over and touch your toes. Perfect. Alright, any lightheaded or dizziness?
No.
Okay. Next, go a little bit to your side, a little bit to your side, and then go back. Any pain?
No.
Okay. Let's do some range of movements with your legs. So go
Okay.
out, forward, back,
Okay.
and then out, forward, and back.
Okay.
All right. Now I can assess again the arms. So push your arms out. Any drips? No. Okay. Now put your arms to the side, and then you can go back a little bit. Any pain?
No.
Up. All right, go down more. Stretch.
Yes.
Okay. Next, I just want you to kind of walk across the room. I'm assessing for your gait and your balance. So go heel toe, just kind of walk across. Okay, and then go back on your tippy toes. Perfect. That was a wonderful assessment. I thank you for giving me the opportunity to assess you. I hope that you gathered some information during this wellness visit as far as, you know, get your colorectal exam,
Right.
follow up with your mammograms, and also put some sunscreen on. You know,
Okay.
more than
Yes.
the 15 like you said. Okay.
Yeah.
So do you have any questions for me?
Not really. I think I know I'm doing my flu shot, like I said earlier, so I will go get that done.
Okay.
So
All right. Well,
I appreciate it.
continue to take those vitamins. You're doing great. Okay.
Okay.
And we'll probably schedule you a follow up with the primary care
Okay.
provider. Okay.
Sounds
and
great.
if you need us, you know how to get us. Okay.
All right. Thank you very
All
much.
right. Thank you.
Thank you.